We are just waiting for us to go live on YouTube. Preparing to live stream. So you guys should see that little notice in the corner any second now.
Great. Thank you, Aniela. Good morning, everyone. My name is Deanna Diamore. I'm the Health Director for the City of Norwalk. It is 8:04 a.m. on March 26, 2024. I'm going to call the Board of Health meeting to order. Present, we have board members Frank Ehrlich, Joan McNeil, Norman Weinberger, Janet Karpiak, Ken Laleen, and Terry Quell. We also have staff members Aniela Fignon, Teresa Argandesi, Kelly Tomlinson, Brian Weeks, and Megan Fogno. Our first item on the agenda is approval of the February 27th, 2024 meeting minutes. Do I have a motion?
So moved.
Norman,
I'll second.
Norman and Joan, thank you. Any comments or edits to the minutes? All right, hearing none, I'll call for a vote. All those in favor of approving the minutes, say aye.
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 Any opposed? Abstentions? All right, minutes passed unanimously. Thank you, everybody. All right, so today we have a special guest. We have Kelly Tomlinson, who is our health educator. I'm not sure how many of you have met her before, but she's been a great addition to our team. She came to us with many years of experience at the Stratford Health Department as their health educator, and she also started with us interning. So we're able to get her back here at the Norwalk Health Department. So she works really closely with Teresa in the Community Health Division and the other staff there. So welcome, Kelly, and I'm going to pass it to you to give us a presentation.
Hey, thank you. Good morning, everybody. Let me just share my screen. Can you guys see the presentation okay?
Yep.
Yes,
Okay.
you can.
So good morning. Again, thank you so much for having me on this morning's Board of Health call to present the Health Department's Heart Month activities that we did over the course of February. February was National Heart Month, and so we did a ton of different activities and initiatives, put out resources and materials all around heart health and cardiovascular health. So I was asked to come today and present kind of on our outcomes. So as I said, February each year was National Heart Month. We really focused on a bunch of different programs and events, as well as resources and education. So Wear Red Day, Know Your Numbers, which is our health screening program, free HIV testing, Live Well, and then resources around the American Heart Association's Life Essential 8, Norwalker, and some of our food access work. So to start off, we have Wear Red Day. So the kickoff to Heart Health Month was Wear Red Day on Friday, February 3rd. Wear Red Day is an annual campaign hosted by the American Heart Association's Go Red for Women campaign, which takes place every year the first Friday of February. This campaign really encourages individuals to wear red to show their support for the increased awareness of heart disease. We partnered with the City of Norwalk. This is our second time partnering with the communications department to really kind of make a big day out of it. We encourage staff to wear red, to take a photo of themselves or with their department, and to share that photo with the communications department to really promote and get out on all of our social media platforms. In addition to kind of the photo opportunities, we did share heart healthy resources with all of our city employees, with the Life Essential 8, which I'll go a little bit more in depth with in a couple of slides, as well as sharing the Wear Red Day background images for virtual meetings. So really just trying to get the color out there as much as possible to start the conversation around why everyone's wearing red and heart health. So next up is Know Your Numbers. So we promoted and held additional Know Your Numbers screenings for the general public as well as for city staff. Know Your Numbers is our health promotion and chronic disease prevention program where we provide free health screenings to Norwalk residents, with really the goal of helping residents know and understand their health status so they can take preventive action, connect to community resources and services, as well as link to healthcare. So these screenings are free. and include the options to get measured for blood pressure, blood sugar in the form of A1C, BMI, and waist circumference. In addition to the screenings, health department staff work with the participants to help them really understand what the screening results mean, if any of the results seem elevated, and what the ranges are. We provide them with health education materials, resources, and we provide a warm handoff to community partners. So example, if they don't have a healthcare provider, we'll try and link them to a federally qualified health center. If they need help with other basic needs, we try to provide them with those resources. Most recently added to our screenings was a checkup from the Neck Up mental health screening performed by Norwalk Community Health Center. So we try to be, as well-rounded as we can. Key program partners for this program have included the Norwalk Library, Open Doors, the Community Resource Hub out of City Hall, Norwalk Community Health Center, and New Vance Norwalk Hospital. Just to highlight some of the work that's being done with Know Your Numbers. So in February for Heart Month, we did hold 3 screenings for a total of 39 participants. Of those 39 participants, we saw about a 79% of individuals with elevated blood pressure, 33% of those elevated A1C, 18% reporting that they don't have health insurance, 13% reporting they don't have a medical home or a primary care doctor. As part of the program, we do offer a follow-up call. So of the 39 participants, 87% qualified for a follow-up call based on elevated numbers. However, when we do that follow-up call, we really only had about a 23% response rate. However, at the time of the screening, 100% of people leave with resources and kind of that education around what their numbers mean and what we suggest, reaching out to their healthcare provider as a follow-up. The program has been around since April 2022, so we're nearing our 2nd year of this program. However, just a summary for last year, we had 24 screenings for a total of 211 participants, and pretty much the same flow. We had the highest amount of people with elevated blood pressure, so about 63%, 37% elevated A1C, 26% reporting no health insurance, with 27% reporting they don't have a medical home. And again, that follow-up call for those that are elevated, a lower response rate for actually answering the phones. However, everyone given resources upon leaving the screening. Next up in our Heart Month series, we offered a free HIV testing clinic. So undiagnosed or untreated HIV could really increase the risk for heart disease. So we worked with our clinical staff to provide an opportunity for residents and their partners to get tested for and education on HIV prevention and treatment options. This was held on the 14th, and really also this event gave us the chance to raise awareness about our sexual health clinic, where HIV testing is always made available. So this past September, some of our staff got trained in the Live Well program. So Live Well is a chronic disease self-management program. We have since partnered with New Vance Norwalk Hospital, as well as the Southwestern Connecticut Agency on Aging. And we intend to hold our first session in end of April, beginning of May. This program is a 6-week session where individuals with chronic disease or someone that they are living with chronic disease can really work on action planning to help gain skills around problem solving, decision making, communication, goal setting, all around how to kind of manage their chronic disease in a long-term healthy way. So the last 3 slides will really focus on the education and resources that we share to residents as part of Heart Month. The first is American Heart Association's Life Essential 8. Originally, this was Life Simple 7. You might have heard of that program as well, but these are really key measures that highlight the different behaviors and factors needed to improve and maintain heart health. So the heart behaviors that they focus on are eating better, being active, quitting tobacco or smoking, and getting sleep. While healthy factors include managing weight, controlling cholesterol, managing blood pressure, and managing blood sugar. The American Heart Association's Life Essential 8 page provides fact sheets in many languages, different recipes, resources, videos. So it was a huge resource that we rely on for our screenings, but also as a send out to individuals, staff, and the public to really help simplify ways that they can improve their cardiovascular health. We also use this month to promote our Norwalker program and our walking maps. So the Norwalker program promotes exercise and walking by offering a series of free mapped walking routes throughout the city. There's about 2 to 3 walking routes for each map for each area of the city. And we really try to promote self-led walks, but also as the weather gets nicer and warmer, we do host a whole array of community walks using the maps all over the city. And then lastly, our food access work. So quality and nutrition of the food we eat has a huge impact on heart health. The health department works closely with a lot of our city partners to help promote food access and help reduce food insecurity for our residents. We have a monthly food provider meeting that we meet with food providers and community services providers throughout the whole city to really talk about food access needs and trends that are being seen. We provide and maintain the Norwalk Food Provider Guide that you can see pictured, which is a whole list of all of the different food pantries, meal services, mobile pantries that are available for residents in need of food. We work to promote SNAP education and assistance and help try to get people who are eligible with services that can help them with the enrollment and maintenance of SNAP. Raising awareness for the summer meal program. So really trying to help promote and expand the understanding of the summer meal program to get students into the schools for meals over the summer when meals might not be as accessible. We share funding opportunities with our partners to help expand their ability to provide food to residents, as well as sharing resources for different events and opportunities that are happening throughout the city. With that being said, that was all of the Heart Month activities. I threw a lot at you, so if you have any questions, I'm happy to answer. I'll stop sharing my screen so I can see you all, but thank you.
Thanks, Kelly, for
Okay.
such a great presentation.
Yeah, Kelly, thank you so much. That was great. A lot of great resources. I just have 2 questions. You mentioned people at the screen and with no health insurance or no medical home. Do you know what kind of resources are shared with these individuals or?
Yeah, so we partner with Norwalk Community Health Center pretty closely. So a lot of times they're on site with us at the screenings so that we have
Okay.
that direct handoff so that they can walk right from, I have this elevated number, what do I do? Right to someone that can enroll them with an appointment either for eligibility to see what they can qualify for on a sliding scale or to get them right into a doctor's appointment. We also provide them with flyers for AmeriCares
Oh,
and Community
okay.
Health Center, CHC.
The free clinic.
Um,
Okay.
And then in terms of insurance, we do have flyers around Access Health CT and how to contact them, as well as the Covered Connecticut kind of
Oh.
to help kind of fill the gap of if you have insurance, but it doesn't cover enough. So we do hand out those resources.
Excellent. Is it possible for me to get a copy of your slides? A lot of
Sure.
great resources. Yeah. Thank you. Okay.
Kelly, just a quick question. What is done in terms of second calls, third calls, fourth calls to those that are non-responsive to the first call?
Yeah, and so we have tried to address this more recently because a lot of times the phone numbers that we leave, either the numbers are no longer in service when we call or the voicemail is full. And so we do try, everyone at least gets that one call. And we did have an intern project where we did have them go through the whole list and provide another call as well. Unfortunately, with the numbers that aren't in service or the voicemails are full, we have kind of a harder time. We did recently switch to include email text as an option. So we ask people what is the best way to reach you. And if they select, text or email, we have a better time kind of shooting those follow-ups a little bit quicker. But everyone does at least try to get that one call. And yeah, it's unfortunately a hard part of the program is getting that second or third follow-up call to see if to get any answers.
I would also suggest, even though I'm uncertain as to how much time you have to do this, when people give you a number, they're there because they want to be there. They came voluntarily. So why would they give you a wrong number? I would suggest if you have the time, maybe have somebody call them, try that number while they're sitting across from you.
No, thank you. That's it. And, or even having that conversation of, you know, we do provide a follow-up call. Does this number
Yes,
work? So thank you.
Mhm.
I appreciate, I'll take that feedback back into the program. Thank you.
Mhm.
Thanks, Frank. Thanks, Joan. Any other questions for Kelly? Thank you, Kelly. It was a great presentation. And yes, we will circulate the slides for everybody so you can see them and look through them. Also want to, for the record, say David Reed, our medical director, has joined the meeting. He's been here the whole time, but he was in the attendee side, so he's joined as a panelist. Good morning, David. All right, next item on the agenda is the external communications policy. So I'm going to pass it over to Teresa to give an overview of this.
Morning, everybody. Can you hear me okay? Yeah, okay, great. So, good morning. I hope everybody's doing well today. Thank you all for taking a look at our external communications policy. The main purpose of this policy is to provide guidance and some structure around print communications, online communications, including our website and social media, to help us promote and get the word out about different health information, but also our programs and services. And so the Community Health Division oversees most of the external communications for the department. And so, as you can imagine, in addition to a lot of the work that Kelly described and a lot of the other programs, you know, that we operate, it is a small portion of our work. And so we try to develop efficient processes to make sure things are up to date and accurate, and that we get information out to the public in a consistent manner. And so this policy is meant to set some guidelines and some parameters so that people can refer to that as they draft things to send to us for review and dissemination throughout the community through whatever channels are best suited for those messages. So that's a quick overview.
Thanks, Teresa. So I know, Terry, you had sent some comments and some feedback. Do you want to just jump in and go first, and then anybody else has any thoughts or feedback?
Sure. I think the policies are very comprehensive. They maybe could be streamlined a little bit, because I just felt like reading them as a new person, it seemed a little bit overwhelming for some of the areas, because there's a real lot of information in there, but excellent information. I had two main questions. Who was the PIO? Is that you, Teresa?
Yes,
Person of
that's
info.
me.
Yep. Okay. That's what I thought. Okay. And then my other comment was in the communication policy, it said the accreditation logo can be included when possible. I just feel like that's such a big deal that we should really make it part of our logo. So I don't know how you do that, whether you put it on the other side of Norwalk opposite the health logo or incorporate it somehow, but I just felt so much work and so much recognition goes into that it would be nice if we could incorporate that all the time.
Thank you. That's great feedback. We do really strongly encourage folks to use it. And I think that feedback shows me that we should create a combo logo so that if someone does want to place it, it's easy. I think we did have some feedback that it is a lot of space to take up especially on printed documents, but for sure we should have something available so that when we're able to fit it, that we get it on there.
It seems like I'm just looking at some of the materials. It seems like you have the I Love Norwalk and then you have the public health logo next to it. I don't see why you couldn't just stick it on the other side of I Love Norwalk or right next to it or something. I don't know. But I think it would be good to include it if you could.
Great. Thank you.
Thanks, Terry, for that. We did include it in the our email signature too, kind of like you're saying, just right next to it.
Yeah. Yeah. And then I just had some other comments that really are for the staff to relook at and nothing significant, but on the larger policy, there was a few areas where there was a real lot of resources listed. I wasn't sure if it was really necessary to list all of those, if people would be really using them. And then a couple suggestions for pulling a couple of things out of the actual policy, like the list of folks that for media, that changes pretty frequently. So maybe that would be in a separate document that you wouldn't have to keep changing the policy all the time. So you can look at those suggestions and take what you want and toss the rest.
Thanks, Terry. So, Teresa, are those media, they listed as an appendix,
Yes.
the media list?
Yeah.
So years ago, when we created, like when we revised the policy, and this is probably because of your comments, Terry, your feedback, we wrote that like so the main content of a policy, whenever we change it, it has to be reviewed and approved by the Board of Health. But if we have something listed as an appendices where it could be changed more frequently, that wouldn't need to go back to the board so that it could be updated more
Oh,
frequently.
Okay.
So I think that's what we were trying to do with this one too, is like you're saying, like those media contacts could change at any time.
Yeah.
That's what we were hoping to do.
Okay. So I didn't realize the appendices don't have to be approved by us. That's perfect then. Okay, great.
Okay, great. So do you think it's ready for a vote to approve changes, or do you want us to come back and make some of those changes? We're working on the other one, the last one, the file policy. We're still working on those edits. We're hoping to get them to you soon, but would you like us to work on streamlining a little, Terry, and then get it back to you, or?
And that's totally up to the staff if they feel it's necessary. I just happen to be a person that likes to try and make things a little shorter if possible, but I don't know how the other board members feel. It doesn't matter to me. Whatever is the will of the board is okay with me.
I'm okay with it being changed by the staff and not being brought back to the board.
Thanks,
I'm
If
fine with that
Jerry's
as well.
okay with it, I'm okay with it.
Yep.
Yeah, I'm okay with it.
All right with that?
Yeah, that's fine.
All right, so then I'm gonna try to phrase this the right way. Do I have a motion from a board member to accept the changes with the policies with a few additional edits, looking into account Terry's suggestions, when possible, to approve the updated policy? Does that make any sense?
So moved, yes.
I will second that.
Terry Wood Jones seconded. Okay, all those in favor?
Aye.
We got it, Deanna.
Okay. Any opposed? Abstention?
No.
No. Okay. Good thing that was recorded. So all right, thank you, everyone, and thank you, Terry, for your review, and Teresa and your team for all the work on the policy, and Yellow for all your help with it as well.
Good job.
All right. The next item on the agenda is the new employee orientation discussion. So I also sent you all the latest version of our new employee orientation policy that had been approved several years ago. And in it, it was kind of similar, where it had the policy is we're going to follow these steps in this appendix, for new employee orientation. And then there's a checklist of things to do. We've been looking at that policy and thinking about, how can we make it better? So when I was in Westchester, one of the quality improvement projects we worked on was how do we improve knowledge about, the department across the departments and the different divisions. And the quality improvement work group decided they really wanted to focus on new employee orientation as a great start to that. So we worked with HR staff to really look into what are the best practices for onboarding and orienting staff. And we came up with this toolkit. And since then, I brought that back with me here, and I said, should we adopt something similar in Norwalk? So the idea would be to move beyond it as a policy and that just one-page checklist, but to make it more comprehensive, and to have what are the steps the supervisor has to do when they're orienting a new employee? What are the things the new employee should be doing? What are the things that should be done before they're even, start, at their desk? What are the things that should happen within the first few days, with the first few weeks, and really kind of separate that out? And so Aniela's been working behind the scenes with staff on like how to kind of how to use that approach and apply it here. And so I'm thinking as we're having all these policy discussions, to me, it seems like it doesn't make as much sense to have it as a policy and have it more as a toolkit or a procedure or a manual or something that can be, because I've been holding on to it and y'all gave it to me probably like a year ago, like what she was working on. And I kept like wanting to add things. Well, what about this thing? Or what about that thing? So I kind of see it as an ever evolving, changing document that gets updated, and be happy to bring it to you when you, so you can see it and for your feedback, but I don't know if it really fits that well as a policy. So I wanted your thoughts on that before we go any further. If you, do you want to keep it as a policy? Do you like this idea of making it more of like a toolkit? Any thoughts
Does
to that?
I have a question. Does Norwalk HR have a policy that encompasses all the separate sections?
They currently don't have one, but I have been meeting with the HR chief to discuss this and to work with her to figure out, you know, what parts does IT need to do, what parts do personnel do. So I have looped her in on it, and she's happy to provide her feedback to our overall policy or
Well,
our toolkit.
I would just say then, if one separate division of Norwalk's divisions has a policy and the overall HR doesn't, I think that opens doors that we don't want to see opened.
Yeah.
So are you saying it's better than to not have it as a formal policy then?
If HR has a policy, you don't need one. If they don't, then you shouldn't have one. I think it should be a toolkit or whatever you want to call it.
Okay, thanks, Frank, for that feedback.
I agree with that. Yeah.
Yeah, I'm fine with it being a toolkit. I'm not sure that we need to approve something like that. And I really did like that whole policy that you brought from Westchester. The one pager that you included that we are using now, I found just a little bit confusing as to, was it the city that was doing pieces of it, and was the health department doing pieces? So yeah, if you replicated that toolkit for our use, I think that would be great.
I think it works better as a toolkit.
Great.
I'm seeing heads nodding.
Things change, so I every time it changes, you'd have to bring it back as a policy, so I keep it as a toolkit.
Absolutely. Great. All right, thank you, everyone. Great feedback, I appreciate it. So we'll keep moving in that direction. Thanks, everybody. All right, next item on the agenda is epidemiology update. So Brian, you're up. Good morning.
Hey, good morning, Deanna. Good morning, board. So just want to kind of use this opportunity to kind of speak about the recent updates to respiratory virus, guidance from the CDC, as you were familiar with earlier this month. There was that change in terms of pretty much an overhaul of the whole system and approach, which I think is overall a net positive. So I just wanted to go through it in terms of what our situation is right now, but at the same time, use it as an opportunity to kind of teach ourselves how to kind of utilize the system. And obviously some of the improvements related to it. So let me just jump right into it. So what you should be seeing on the screen is the initial loadout page for the new respiratory virus section from the CDC. So again, what pretty much has happened is that COVID-19, along with flu, RSV, and just generally other respiratory viruses that are circulating, are kind of lumped together in this super category. And so it makes it a lot easier in terms of communicating guidance and also kind of monitoring the situation, especially for the big three, COVID-19, flu, and RSV. And so as you can see here with this page, you have the ability to interact with it, select your state and then your county. And so I already kind of preset our conditions here. And then we can kind of see the real-time situation in terms of the CDC processing this every week. And so right now they're qualifying Fairfield County or Connecticut as having low overall respiratory illness activity. So that's good to see. And then the illness trends relative to the county itself for the big three. So flu, no change, RSV, no change, COVID-19 decreasing. So that's good news as well. And then they get into the hospitalizations, and they're saying low COVID-19 hospitalization levels in Fairfield County. And then just a little bit of guidance in terms of those very sick, talk with your healthcare provider about additional prevention actions, a little bit more situational awareness relative to Fairfield County you can click on and interact with. And then there are also additional guidance items, which we'll also go into greater detail later on. But really quickly, again, it's, staying up to date for your immunizations, obviously, if you're eligible for it. In terms of, anybody that's an adult 60 plus, should talk to the healthcare provider, whether a single dose or RSV. So there's a lot of breakdown in terms of the recommendations of the different vaccines, practice good hand hygiene, and also respiratory etiquette. And then, take steps for cleaner air. That includes air purifiers as well as ventilation, opening up windows if the weather's obviously permissible for that. But also keep in mind that, we're in allergy season now, so we have to kind of factor that in too. If you get sick, stay home away from others to prevent spread, seek healthcare for possible treatment if you get sick and have risk factors for severe illness, and other tools such as masks and distancing. So overall, this is really great kind of summary page relative to one can kind of seek out information relative to their county. So then getting a little bit more into the detail, the other great thing about this, as you'll see with this page, everything's been just compiled into this one page relative to these surveillance metrics. So it's really helpful to kind of know what's going on. As you may recall, I had to kind of mix together what was from the State Health Department dashboard, from the CDC, then also the wastewater monitoring, but it's all here on one page now. So as you can see with the first infographic, this is looking at the level of respiratory illness activity. So this is the syndromic surveillance for influenza-like illness. As you may recall, it was more tailored towards influenza, but now it's been more generalized, which I think is a very good measure and an approach, just because, symptoms like fever, cough, things of that nature, unexplained fatigue, can kind of meet all these respiratory illnesses criteria. It's not necessarily just influenza. So this makes it a lot better in terms of a tool to monitor the respiratory illness situation by state. And as you can see right now, it's more like the Midwest, a little bit of the Southwest that's kind of experiencing that higher activity relative to respiratory illnesses. You do see Massachusetts and New Jersey having a little bit more kind of moderate, if not high activity, especially New Jersey. And New Hampshire just kind of getting a little bit higher than the low. But fortunately for Connecticut right now, we're in the low relative to this surveillance metric. So overall, really nice visual, summarizes it very well and generalizes it really well, given the nature of syndromic surveillance. Now switching over to emergency department visits for respiratory viruses. This is, obviously one of the most important. And so we're seeing it right now initially load out for the whole country. So we can kind of see what the trend situation is over, the last few months. And so what you can see is the blue is influenza, which is still, the highest in terms of the proportion of the weekly emergency department visits nationally, followed by COVID-19, then followed by RSV, which is pretty much at baseline levels. But you can see, generally speaking, they're all kind of downtrending, which is really great news and great visuals to kind of, verify that. So now we switch over to the state, and kind of following what the, that initial visual we saw kind of indicated. Generally speaking, everything seems to be more or less in the downtrend, if not stable. But you can see how flu is still higher than COVID activity, but RSV is at baseline activity. And now if we just zoom in now to Fairfield County, this is where it gets a little interesting. You can see, again, that downtrend for COVID, RSV pretty much at baseline levels, but the blue for flu is kind of stable. So it's still a little bit high. So that's something else we need to factor in and keep in mind relative to Fairfield County. And so it's really great. You could just interact with this one visual pretty much to get the situation relative to severe illness, emergency department visits. Somebody has to go to the emergency department because they're experiencing, some sort of primary or secondary condition related to their infection. So I think that's really great that they kind of provided that and summarized it in that way. And it makes it easier for me to communicate this to the public, and then the public also be able to pull this up themselves. And so finally, just want to kind of cover really quickly just kind of what was originally called the isolation guidance. The CDC has moved away from quarantine and isolation terminology. It's really more staying at home, avoiding obviously infecting others, while you're obviously in a infectious state. And so, generally speaking, again, this is being applied to all respiratory viruses. This is a really great infographic that the CDC has put together. And so there's core strategies, kind of like what we were talking about before. So I'll just go through it quickly because you guys heard this a million times. But it's about immunizations, hygiene, and again, that's, respiratory and hand hygiene. Steps for cleaner air. We were talking about the air purifiers, ventilation, things of that nature, but also factor in allergy season, the treatments that exist, relative to eligibility, and then stay home and prevent spread. And so this is here in the bottom right corner. that visual is stay home and away from others for 24 hours until these two conditions are met. Your symptoms are getting better and you're fever-free without any medications, predominantly fever-reducing medications. And so again, unlikely that's going to be just one day. You know, you might have to stay back for a few days. So this is, again, I would like to qualify it as bare bones or bare minimum kind of guidance. Because then on top of that, keep in mind, you know, an individual can kind of go back to the normal routine as long as they take those precautions that are outlined here for the next 5 days. And so this is just really important as well, because they still technically are in a state where they can still transmit the virus. It's just a lower viral load than compared to when they're fevering, you know, experiencing fever. So again, just to reiterate, this is kind of bare minimum guidance, but it's standardizing this for all respiratory viruses, which is really great. It's a lot easier to communicate and for the public to understand, and also workplaces to apply this in other institutions and facilities. And so again, symptoms get better, plus you are fever-free without any sort of fever-reducing and other medications. So that's really important. And again, this only applies to community guidance. Healthcare guidance is still using the older kind of respiratory virus guidance that we're familiar with, and the other strategies associated with it. So again, there's a differentiation here between healthcare and community. And so with that also said, there's still also additional prevention strategies. That includes masks, and especially during those 5 days, it might be a good measure to also kind of just, you know, take those precautions along with, you know, just the social distancing that we're familiar with, you know, just avoiding that risk of exposing others, especially those at greater risk of illness, and then also doing testing, right? So we still have those rapid tests out there for COVID. If they're still within those, you know, expiration windows, and make sure to double check with the FDA webpage just to verify if it's still actually usable too, because, you know, those have been extended quite a bit. But, you know, we do have these other strategies that are also very helpful to kind of help mitigate. So altogether, in summary, all these strategies help mitigate the risk of any respiratory virus transmitting to others as long as we follow these. And this is bare minimum. So the expectation is we should be easily able to kind of achieve that. And so, and to that point, the CDC kind of outlined with some text here just about layering these strategies. That's the terminology they use. Because, you know, we also need to factor in kind of what the respiratory illness situation is in the community. And so right now we're obviously in a better situation than we were earlier in the year. You and those have factors for severe illness, so also factoring in kind of who you might be working with, who you might be socializing with too, in terms of their risk. If you're visiting grandma, grandpa, and there's going to be a lot of close activity, just being mindful of those things as well. You know, say if a child's ill with a respiratory illness, and then also you or those around you were recently exposed or sick and are recovering, being mindful of that as well. So factoring all these strategies together with this really great visual and these great, you know, updates to the website makes it a lot easier for us to kind of hopefully mitigate respiratory viruses in our community, as well as, you know, in our state, nationally, and also globally. So this is overall I think a net win for everybody in terms of this overhaul from the CDC. Came a little bit earlier because it was anticipated not until April, but it's kind of great that they actually did this, and they kind of did it more or less on the anniversary of COVID, the 4-year anniversary of the pandemic. So I think it's overall, you know, a great opportunity and a great resource for all of us to kind of utilize. So that's just kind of the overall breakdown relative to the respiratory virus situation. Thanks.
Ryan, how do we account for the non-reporting or general, you know, patients don't necessarily self-report very well to their clinicians if that's how the information is being tracked? How do we account for those types of situations where people are testing or masking or whatever it might be that is not being reported?
So right now, again, there's been that shift. You know, it was almost like 2.5 years into the pandemic since the start, where we kind of moved away from, you know, at-home tests as like a surveillance metric. First of all, it's very difficult to get that information unless somebody self-report it. We do still have at the local level, and this is a great opportunity to speak about this, community requests form that you can find on our website. If anybody wants to request any sort of guidance or clarification, because obviously there is a little bit of confusing now with all this new guidance here. If somebody's not familiar with it or know where to access it, they can reach out to us and we'll provide that guidance. We'll reach out to them. We still have a contact tracing team that's willing to help them. But to that point, you know, the focus is more so severe illness. And again, it's looking at those emergency department visits because, you know, that also gives us an indication, you know, in terms of transmissibility, in terms of, you know, greater risk, you know, maybe it's also a mismatch potentially with the vaccine, whatever it may be. It's going to give us that really good indication. But in terms of at-home testing, there's not really a great surveillance system in place, nor has it been prioritized in terms of the the healthcare or the public health infrastructure at the national level or even at the state level to kind of monitor that. Because again, the focus is severe illness, right? That's what we want to mitigate because we're living with these viruses. They're always going to be circulating. There's going to be a seasonality to them to some extent, more so than others. We just got to kind of manage accordingly. And then this is where everybody kind of comes together, public health and healthcare, to really kind of do our best in terms of communicating this, and also the community doing their best too in terms of mitigating that transmission and hopefully mitigating that future risk of mutations that kind of create maybe a super virus, which we're hoping that doesn't happen. But nonetheless, we also have to kind of keep an eye out for it. And so this is, again, from my kind of standpoint as an epidemiologist, it's really great that we have all these surveillance systems in place that the CD has kind of consolidated, because we can then monitor for the severe illness to indicate maybe a subvariant or variant of greater concern. And then subsequently, guidance will be modified accordingly if there is something of very great concern.
I have-
David, the severity is the key factor. And once we started having tests for COVID, for example, you know, a lot of people disappeared because they did it at home and they either took care of themselves. The other thing is when we were doing all the testing in the nursing homes, we tested a lot of people that were elderly, 80s and stuff. They tested positive and had no symptoms. So there's always going to be that cohort that is not that sick, and that's good. We're just looking for people who are sick with comorbid conditions and so forth to get into treatment and the treatments we have. But I think it's very effective just to follow the severity of it.
I have a comment and a question. The comment, I've been using this site for some time in my own personal computer, and one of the hidden uses of it, if you're going on a trip, taking a trip to Pennsylvania, Vermont, wherever, you plug in that state and county, and you can find out for yourself what the status of respiratory problems is and will be. May help you decide to go, not go, wear a mask, etc. The other thing is just a question for you, Brian. With the recent pronouncement of a measles case in Long Island, how safe are we in Fairfield County?
So I'll speak briefly about that. Fortunately, given our IAP team here, Immunization Action Program, we're very fortunate in terms of very high vaccine uptake rates compared to other parts of the country. So we are better insulated against that. Nonetheless, it is natural to have some measles cases pop up. That has happened in the past. Everybody in terms of the public health infrastructure is, prepared for this, including ourselves. We have been doing, even practice exercises in terms of getting ready to deploy and answer, any sort of situation that we may have. And so, everybody's kind of got the hairs back up on the neck. I mean, I will say April is usually a rough month for that. And so we're very much prepared and ready for that. And so thank you for mentioning that, along with the CDC HON, the Health Alert Network message that has gone out. And there's been a couple others actually related to it, just to kind of reemphasize that point. So we have been also nudging other healthcare providers in the area just to keep an eye out for, to monitor for any symptoms that may remotely look like measles, to also do the appropriate testing so we can act quickly. Because one of the biggest concerns with any measles situation is a lot of exposure scenarios. And so we want to mitigate that and catch that early. So hopefully when an individual goes to the doctor the first time, they catch it. And so the person's taking the proper precautions. In that case, definitely isolation, that terminology applies. So they're not exposing others, and then let alone determining their contacts so that we can mitigate any secondary cases related to it. So yeah, you're mentioning something that we're very much not looking forward to dealing with, but we're also prepared for. Along with, obviously, yeah, it's a very real issue because that has been growing in terms of the number of situations we see in the news, as well as these alert network messages.
I just want to make an addendum on the CDC. It's very good for the states, but we have very sophisticated travel software for our clinic that tells us everything. But the CDC does that as well. So if you travel nationally, a lot of people come into the clinic with good information. So it's a source for both national and international.
Thanks, everyone.
Brian, I'm sorry.
No, go there you go.
I just had a question. Are those links on our website, Brian?
In terms of the web pages for the CDC, I believe so. So, you know, we could double check and then also kind of, you know, just ensure that you guys have it in the chat. I don't know if I never quite figured out how to do the chat on this because it doesn't seem to pop up. So I can kind of drop the links in there as well. But I don't see it on my end.
Good point. I don't see it on my end either.
I don't think we have a chat on the web feature because this is a webinar. So I think we only
Oh.
would have like a Q&A section. So that's why. But we could follow up in email after.
It would be helpful, I think, if they were on the website, but I'm just not sure where they would be on the website. So great, thank you.
So if you go to norwalkct.gov/health, and you go to to the health department's main page, you'll see there's a button there still, like an icon that says coronavirus. And if you click on that, you'll see there's a lot of information that we've housed in the past, and Teresa and her team have been working on trying to update some of the links. So there is a new infographic that Brian showed. It's on our website, and we can look to see if there's some of those other links. Teresa, I see you. You're here. Any other?
Yeah, I was just
anything to
gonna
add to that?
say that's also accessible by going to norwalkct.gov/COVID. And that just takes you to the main page with that lists the different subpages that we have. And I do think that we link to the CDC guidance on a couple of those pages.
Great. Okay, good. Thank you.
Any other questions, discussion related to Brian's update? All right, so then I'm going to jump into the director's report. So just a couple quick things. One of them was as a follow-up to last month's Board of Health meeting, I discussed Terry's suggestion of having an event to publicize the exam room renovations. And so staff were thinking, suggested planning something for later in the spring. Once all the finishing touches are made to the room, there's still some pictures to be hung and some, final nice touches. So we'll keep everyone posted on the plans, and we'll circulate an email to try to get out, availability for dates so we can have as many people as possible participate. So thank you again for that suggestion. Also wanted to say that the team has been working on documentation to submit our annual report to the Public Health Accreditation Board. It's due in like 5 days. So we'll give an update next month on that, but the team's been working hard on that. So thank you to all the staff led by Aniela. I'm working on that report. And then I also wanted to share with everyone that Ken and I met last week to discuss reports out to the Board of Health. He had asked me about some of the financial reports, and budget reporting, and then I jumped up and I said, "Do you have suggestions?" Because I know Ken has a lot of experience, working in his roles as CEO and executive director and other things, as well as his involvement in boards. And so we had a really great meeting and conversation. I really, took good notes and took his suggestions down. And so we talked about just different ideas. We were talking about like reporting both on the fiscal side of things, but also as like the operating programmatic side. And so we talked about, what would be most helpful to the board to know, just have a pulse on like what is going on, in the department beyond, these periodic updates that we give during board meetings. And so we talked about that, and I'll get back to that. But we also just talked about how like valuable that meeting was to me, just to be able to sit down and pick Ken's brain for some time. And so it made me also remember, when Frank joined recently, he was able to give me some thoughts too, and advice and guidance. And anytime a new board member comes on, we're able to sit down and talk. But I thought about, we talked about, would it be possible? This is where you all come in. Just to meet with me periodically. So Ken and I were talking, the commitment from the board members would be, twice a year to sit down with me, just to meet one-on-one, to, get updates, but then also to pick your brains and to get some ideas, and also to help like shape future agendas at board meetings. Because, that we don't have a chair like a lot of committees do. So we floated that idea around. So we wanted to bring that to you, and also wanted to let you know that, some of those reporting, I'm taking a course right now at NACCHO, National Association of County City Health Officials, on financial management, and they are going to go over some tools and reports, formatting for things. And so I'm going to look at that. But so over the next few months, I'm going to be working on some ideas for some reports, and I'll share them with you as I do them, but wanted to get your feedback on, would you be willing to meet with me twice a year? So it'd be like I would meet with a board member once a month, but because there's 6 of you, it would be, the commitment would be twice a year. So I wanted to know what your thoughts were on that. Ken, anything to add to that?
No, I think it was a great opportunity. We really had a nice conversation. It led to a lot of potential interaction with staff, interaction with, something we report to the public. How are those things being handled? And I felt that this is a great group to get together and allow for picking of the brain, if you would. And I think a lot of good things come out of that type of a process. And it gives board members an opportunity to step up and have a direct conversation with the director. I think that in previous functions I had, it was always at least once a year I had a meeting with each board member, depending on the size of the board. But it has been very valuable in previous situations, and I wondered how you all would feel about that.
Yeah, I think go ahead.
I say yes.
Absolutely. I think it's a great idea. I kind of miss the full board meetings, and this is in a lot of ways more convenient. But even to have a board meeting a couple times a year as well in person would be wonderful again.
I agree. And I think it's also helpful. We had a couple of, I was able to participate in a couple of kind of strategic planning kind of things. And I think we could do a strategic planning thing from the, just the board, just to do a group kind of thing. That might be something that would be really valuable as well.
Deanna, I agree. I think it would be very valuable to sit with you twice a year.
Great. Thank you all. So I'm taking down notes too about, a couple of times a year in person, group thing, strategic planning as well.
I think the board involved in strategic planning has been done in the past. And I think it's always a good idea to get different points of view, or, you may produce some statistics and think it looks like this, but to other people, it can have a, different reflection. So I think the more input, the better.
All right. So should I come up with like different month schedule? I was thinking like it would be good maybe to meet 2 weeks before each board meeting, so they're kind of staggered, and then think about the next agenda. Does that work, you think?
Sure.
Oh, definitely. Yes.
Sounds good.
Okay, great.
Absolutely.
All right. Well, thank you very much. This is great. I'm excited about this. I'll be reaching out soon to schedule those. I always say how smart you all are and how accomplished you are and how you have such great insight. So I really appreciate everything you do for our department and for me. So thank you. All right. With that, the next item on the agenda is public participation, but I don't see anybody is attending. So anything else before we wrap up?
I had one other question. I know that sometimes these are posted on somewhere on TV, because a couple of people have told me that they've seen them. Is there any particular schedule? Like, is there any particular time that they post them?
Right after the meeting. So if you go on the city's YouTube page, so you'll see them right away, and they are linked to the website too, but you'll be able to find it right after. I can send you that link, Terry, if you want.
No big deal, but I just was curious because I've heard that they've been actually on television, posted somewhere on television as well. Yes.
Oh, really?
I didn't know that.
Yeah, there's some. I don't know if it's a place where they also do common council meetings or something, but I've had several people tell me they had the TV on and they heard my voice and then they saw it was a meeting and I'm like, what? So I'm just curious.
That's very likely just someone using YouTube TV.
I was just gonna say that.
YouTube TV 24/7.
Oh, yes. Yeah.
And that's what I was thinking, that it's probably YouTube TV, because they're actually posted live. So if you go on YouTube right now, you'll see it might be a little bit backlog from this live session, but it will be live on YouTube right now. Sorry, Frank. Go ahead.
We watch 24/7 on YouTube TV. So wherever you were, or the person was, they were probably listening to it on YouTube TV. And it can be,
Interesting. Okay.
and that works on your regular 78-inch TV.
Right.
78.
Teresa, have you ever gotten any feedback from the public on, you know, one of the, oh, I saw it on YouTube or in a video, or no? No?
I haven't heard anything specifically from the public about the board meetings. We do get a lot of reach and impressions when we post health education videos versus static content. So we do have a YouTube page for the health department. The board meetings are on the city's YouTube page, but then the health department has a YouTube page where we post some videos as well.
Much preferable that they watch the health education.
Agreed.
All right. Anything else? All right, well, it is 8:59, so we will adjourn. I hope everybody has a great day today. Thank you for everything.
You too. Thank you.
Thank you.
Bye-bye.
Bye now. Have a great day.
Thanks.